Hello, everyone. My name is Eun Ji Chung, and I'm an assistant professor of biomedical engineering, chemical engineering, material science, surgery, and medicine at the University of Southern California. I did my training at Northwestern University, and I did my postdoctoral research at the University of Chicago, where I conducted various biomaterials and nanomedicine approaches for a variety of applications, including cardiovascular and cancer. More recently, at the University of Southern California, our research has been very much focused on kidney disease, and thus far, we've been fortunate enough to get sponsorship and support from federal as well as private foundations and companies. So more broadly, our research focus encompasses developing biomaterials, various small molecules, biomolecules, to then drive them into a specific architecture and assembly to then be useful for an application of interest. And this really highlights our design and our motivation process. We're ultimately always looking at the physiology, the pathology of the disease, to then inform our material design so that it can be effective for that tissue and organ of interest. As I mentioned, our focus has been primarily in kidney disease. And although nanomedicine is not a new type of medicine and has been driven into the clinic and is available for cancer applications as well as other types of patients, for kidney disease, there isn't too many options in nanomedicine. We know that about 1 in 7 people in the US, or about 15% of the US adults, are estimated to have chronic kidney disease, and that's about 37 million people. But despite that, very few and sometimes no nanomedicine approaches are available for specific kidney disease. One such disease is polycystic kidney disease, or PKD. In this application, or in this disease, it's a hereditary disease, and it ultimately causes your kidneys to have cysts, fluid-filled cysts, that are then decorating all of your nephrons or your individual units of your kidney. And ultimately, by the age of 60, half of patients will reach end-stage renal disease or the need for dialysis and transplantation. PKD affects 12.5 million people worldwide, and in the US, it costs about $10 billion annually. However, there are very few therapeutic options, and only until recently, secondary symptoms such as high blood pressure and urinary tract infections were available. And now in 2018, there is now one FDA-approved drug. Unfortunately, this drug, as well as a variety of drugs in the pipeline, cause off-target side effects that are not tolerable in many cases for patients, due to its inability to depot in a majority manner to the kidneys. And so our nanoparticle and our technology is based on rationally designing the physical chemical properties of the nanoparticles such that they can extravagate into the kidneys using their size, their charge, and other types of targeting ligands. These types of nanoparticles that we've designed are based on peptides and amphiphilic structures that are very similar to our cell membranes. And you can see that unlike the non-targeting nanoparticle on the bottom, as well as other types of drugs that primarily localize to the kidney or to the liver, our nanoparticles can get uptaken into the kidney as shown in this mouse model. We've incorporated different types of PKD drugs, but it can be used for a variety of applications as well in kidney disease. PKD, however, is a chronic disease. So unlike nanomedicine that's injected intravenously, it has to be delivered in a manner that's patient compliant. And so we've developed these oral delivery platforms as well as transdermal microneedles that the nanomedicine can be placed in, so that the patient does not get disturbed in their daily life in administering this drug. And you can see on the right that in the mouse model, we can decrease cystic burden and kidney size compared to a mouse that was just given free drugs orally administered. And so right now, we are looking for collaborators to catalyze our first-in-man studies. You can also find more about our research in the poster by Jonathan Wong, a PhD student in our lab, And these are my contact information and our website, as well as our Twitter handle. And so thank you for your attention, and I'm happy to speak with anyone that is interested in driving this work into patient care. Thank you.